Good morning. My name is Steve Pelton, and I'd like to thank you for attending today's online presentation, Medicare and You, presented by Jennifer McLaughlin from the Lake County Council on Aging. We will be muting all participants until after the presentation for the question and answer session. Please be aware of background noise during the question and answer session and self-mute so that all participants can have the best viewing experience. Now I'd like to turn it over to Ms. McLaughlin.
Thank you. My name is Jennifer, and I'm actually the manager of the Aging and Disability Resource Center here at the Council on Aging, and I'm also a certified OSHIP volunteer. And OSHIP is the Ohio Senior Health Insurance Information Program. I'll be talking today about Medicare. This is actually a very similar presentation that we do during open enrollment. We will be doing this presentation during open enrollment at many of the senior centers with more detailed information for 2018. This will be just a very brief kind of overview of Medicare. What is Medicare? Medicare is the federal health insurance program that's administered by the Centers for Medicare and Medicaid Services, or CMS. Some people confuse Medicare and Medicaid. Medicaid is the state insurance. Medicare is the federal. It's for people who are 65 and older, or any age if they are disabled, or those who are diagnosed with end-stage renal disease. As this slide shows, there's two ways you can get Medicare: the original Medicare, Part A and B, plus a secondary insurance or a supplemental, and a prescription drug coverage. Or the second option is to do a Medicare Advantage plan, which kind of wraps all those three parts of original Medicare into one. So we'll talk a little bit about both this morning. Applying for Medicare. If you are receiving Social Security or Railroad Retirement benefits prior to turning 65, you will automatically be enrolled in Medicare. You'll get your card in the mail probably about 3 months or so before you turn 65. If you're still working and you want to defer any benefits, you'll have the option to do that at that time. If you're not receiving Social Security benefits, you will have to apply with Social Security during the open enrollment period for Medicare. The initial enrollment period for when you turn 65 is the 3 months before your 65th birthday, the month of your 60th birthday, and the 3 months after your 65th birthday. So 7 months total there to get signed up for Medicare. If you are getting Social Security because of disability, you will get your Medicare card in the mail typically like about a month before the 25th month. You have to be on disability for 2 years before you would be eligible for Medicare if you're under 65. If you are covered under your own or your spouse's current employer health insurance, then you may delay enrollment of Medicare Part B. There's a form that your employer would need to sign to verify that you do have credible coverage, but you can delay enrollment if you or your spouse is still working and you have coverage. This is what the Medicare card looks like. In 2018, I believe in March, they're going to be rolling out new beneficiary cards that do not have the Social Security number. Right now, your Social Security number is your Medicare claim number. So in the future, they're going to start doing a Medicare identification number, which will be, from my understanding, a combination of numbers and letters. So that'll be starting to roll out with new beneficiaries in March of next year, and then gradually kind of catching everybody up. They'll be getting new cards in the mail. Original Medicare, it consists of Part A and Part B. Part A is your hospital coverage. So it covers inpatient hospitalization, skilled nursing facilities, home health care, and hospice. The Part B covers outpatient services, your doctor's appointments, providers that you go to, preventative benefits, and durable medical equipment. It's important to note with the Part A inpatient hospitalization is that sometimes people can be in the hospital but not be inpatient. They're considered outpatient, so they're just an observation. So Part A covers only the inpatient if you're fully admitted to the hospital. Medicare was never intended to pay 100% of healthcare costs. It typically covers about 80%, and then the supplement would pay the majority of the 20% that you would still be responsible for. Medicare does not cover non-medically necessary services or care outside of the United States in most cases. Durable medical equipment, prosthetics, orthotics, and supplies must be obtained from a contracted supplier in order for Medicare to pay. Medicare preventative benefits include screening tests and procedures. There's typically no out-of-pocket costs for most of the preventative benefits. The examples are a flu vaccine, pneumonia, hepatitis B. Once you turn 65 and are on Medicare, then you have, in that first year, you will get like one Welcome to Medicare checkup that is typically completely covered by Medicare. There's no charge. And then after that, you'll have an annual wellness check. The preventative benefits also include some of the diabetes testing supplies. At the bottom of the slide, it just gives reference to the Medicare.gov website for more information about that. In 2017, this is what you can expect to pay for Medicare. Part A is typically premium free. There's typically free. If you've worked your 10 credits for Social Security, you get it at no cost. The hospital deductible for Medicare is $1,316 per benefit period. A benefit period is 60 days and begins the day that you're admitted to the hospital. So if you're in the hospital and then go to a nursing home maybe for some skilled rehab, and then 65 days later you're readmitted to the hospital, you'll be paying that $1,316 again. It's per benefit period. You have to be out of skilled nursing facility or the hospital for 30 days before a new benefit period would start. The hospital copays for days 61 through 90 are $329 a day, and $658 a day for days 91 through 150. Those are your lifetime reserve days, and once you use those, they are gone. There's no more. The skilled nursing copay for skilled nursing care in a facility, the first 20 days there's no charge. Days 21 through 100 is $164.50 a day. Many times people think that, oh, Medicare gives me 100 skilled days for a nursing facility, which is true, but they only pay for 20 of them. The days 21 through 100 you're responsible for. Part B, the monthly premium, if you are enrolling in Medicare Part B in 2017, is $134. The average Part B premium of what people pay this year is $109 if they were enrolled before 2017. The reason that is prior to 2017, there hadn't been a cost of living increase for a couple of years, which means the Part B premium didn't increase. So the average of what people pay is $109. The premium may be income-based, so if you make if your income is higher, then you may pay more than that. And it's important to know with Medicare Part B that if you enroll late, so if you enroll beyond that initial enrollment period, you could be facing a 10% penalty for each year of delay. So if you have credible coverage through your employer or your spouse's employer, then that fee is waived. There's no penalty. But some people, I've heard, think that because they're not sick, they don't go to the doctor, they're not going to take Part B right away, and then here 3 years down the road, they decide to enroll in Part B and end up with a pretty significant penalty that stays with you for the rest of your life. So in addition to the $134 for this month or for this year, for example, you could have a penalty then tacked on to that would always be there. Part B has an annual deductible as opposed to a deductible paid per benefit period. So typically we're all used to annual deductibles, and that's what Part B is. It's $183 for 2017. When we do the presentations this fall, we'll have the updated numbers for 2018, be able to talk more specifically about that. Co-payments for Part B are generally about 20% of what the Medicare approved amount is. There are Medicare savings programs that can help with paying the Part B premium if your income is less than $1,377 a month, and if you're single, or $1,847 if you're married, and if your resources fall below $7,390 or $11,090 if you're married. The programs that are administered by Job and Family Services, Council on Aging can help you to apply for those programs and see that process through. But if you qualify, if your income is very low, then you may qualify to have the Part A and B co-insurances and deductibles paid as well as the Part B premium. So we talked about original Medicare being Part A and Part B. The second part of this is a secondary insurance, which could be a group health insurance, a Medicare supplemental insurance, or Medicaid. Obviously, group health insurance is from your former employer, or if you're currently working. Medicaid if you have limited income and resources, or if you qualify for one of the Medicare savings program. QMB is the one that has a very low income threshold that kind of acts as the free Medicare supplement. And then there's Medicare supplements, which are private insurance that coordinates with Medicare. You might hear them referred to as Medigap or MedSup. Some people confuse the Medicare supplement with a Medicare Advantage plan. They're actually two very different things. It's important to note, too, that if you're covered by COBRA, that does not count as group health insurance. So if you're covered by COBRA for quite a while and then go to enroll in Medicare later than the initial enrollment period, you could be faced with a penalty since it's not considered group health insurance. Medicare supplement insurance, the plans are standardized. There's plans A, B, C, D, F, G, K, L, M, and N. They're the same plan no matter who sells them. They all have the same benefits, but the premiums can vary between companies. So there's many plans out there. It's important to do your homework and to get to know the plans and the providers of those plans, so you're getting the best bang for your buck, so to speak. The benefit of Medicare supplement plans is that there's no network. You can go wherever Medicare is accepted. Typically, people like the Medicare supplements if they travel a lot. For example, if they're snowbirds and go to Florida or Arizona for the winter months, they don't have to worry about any kind of network or anything. They can just go to a doctor there if need be. They pay only after original Medicare, so Parts A and B. After that's paid, then the Medicare supplement would pick up the difference. There's typically little or no out-of-pocket costs after that monthly premium. With that being said, the monthly premium can be anywhere from just over $100 to $200 and some a month for a supplement. So some people like to have that, knowing that they pay their monthly premium and the coverage is there if they need it. Other people would rather pay as they go, which is more of the Advantage plan, and we'll talk about that in a little bit. Guaranteed issue. During your initial enrollment period, if you enroll in a Medicare supplement plan, you are guaranteed issue, which means that they cannot ask you health-related questions and they can't base your premium on that. After that, if you go to change to a Medicare supplement plan, they can ask you health-related questions and charge you more for the plan based on your health status. You're also guaranteed issue in special circumstances, which typically is 63 days after the loss of coverage. So if you're working or your spouse is working and that coverage ends, then you have those 63 days following that event or that termination to enroll and be guaranteed issue. So we've talked about the primary coverage of Medicare, the secondary coverage of Medicare. The third piece of this original Medicare option is the prescription drug coverage, or also known as Part D. Prescription drug coverage is offered by private companies that contract with Medicare, and you can get it through a standalone prescription drug plan, this option, or actually I believe all of the Medicare Advantage plans in our area in Lake County have a drug component built into them. The initial enrollment is about the same as Part B. All people with Medicare can get Part D, and you may not need it if you have credible coverage. It's important to know, too, that there's also a penalty that goes along with enrolling in Part D later than the initial enrollment period. I know I'm skipping ahead. The penalty is 1% of the national base beneficiary premium. So for this year, it's $35.63. So 1% of that for each month of delay, which can add up if you delay it for a long time. Again, people think I don't take any medications, I don't need prescription drug coverage, and then when they do need it down the road, then they end up with the penalty. The prescription drug plans, they have an annual deductible. Some of them have no annual deductible, up to $400, and typically the copay is about 25% or a flat copay based on the formulary. Just a real quick note about the donut hole. The coverage gap, also known as the donut hole, once the total drug cost reaches $3,700, you are in the donut hole, and that's what you pay, what the company pays. So some people, if you take insulin, for example, or any inhalers, you could get to that $3,700 pretty quick. When you're in the donut hole, you pay 60% for brand name, or there's a 60% discount, I'm sorry, for brand name, or a 49% generic discount. That the discount's going to go up, and it's anticipated that the donut hole or the gap will be closed in 2020. Once the costs reach $74.25, then you are in what's called catastrophic coverage, and after that you pay approximately 5% copay for your medications. I am going to back up because I just wanted to talk real quickly about the low-income subsidy or extra help for 2017. If you qualify, and the income and resource limits are on your screen. If you qualify, then you could have a reduced or no premium for your prescription drug plan, a reduced or no deductible, and you would pay no more than 15% of the copays. There's also no donut hole if you qualify for this, so you wouldn't have that spike in cost. All right. So that was really quickly Medicare option 1. Option 2 is the Medicare Advantage plan. which is also known as Part C. Like I said, it combines hospitalization, medical, and prescription. It's available to those who are enrolled in Medicare Part A and B that live within the plan service area, so Lake County for us, and there's no age or medical restrictions except for end-stage renal disease. If you have end-stage renal disease, you have to have a supplement, not a Medicare Advantage plan. It's an alternative to original Medicare offered by private companies, and the plans are either HMOs or PPOs. So we're still talking about networks, some of them just a little bit more fluid of a network. Most of the plans, I believe all of the plans in Lake County include the Part D benefit. The enrollees, if you enroll in a Medicare Advantage plan, you still pay that Part B premium and other applicable costs unless you qualify for one of the Medicare savings programs. The network's premiums and copays all vary by plan. The initial enrollment for Medicare Advantage is the same as traditional Medicare, with the 7 months surrounding your birthday. Open enrollment is October 15th through December 7th of every year. Any changes you make during open enrollment, the coverage starts January 1st. If you join a Medicare Advantage plan, you actually have the first 45 days of the calendar year to try it out for size and see if you like it. If you don't like it, you can disenroll from the plan and return to original Medicare with a Part D plan. This is kind of a screen that compares Medicare supplements versus Medicare Advantage. The choice between the two is really individual. Some people will come in for a one-on-one counseling and say, oh, my friend said to go with this plan because this is what she has. She has an Advantage plan. Where actually, for the person I'm talking with, the supplement might work better. So it's really just taking a lot of things into consideration. Budget is often a big thing, as well as, again, the ability to travel and move around, to move about the country. The last thing that I have is just a little word about protecting yourself from unscrupulous sales practices. If any of you have approached your 65th birthday or even past it, you know that the amount of mail greatly increases as you age, and as open enrollment comes around, everybody's vying for you want your money. So there's you get a lot of mail. There is some prohibited sales tactics, though, to keep in mind. Door-to-door sales, giving out cash gifts or gifts exceeding $15, high-pressure sales. If you feel that you've been victimized or that somebody's inappropriately trying to sell Medicare, then there are ways to report that. The numbers are there at the bottom of the screen. And that's all I have. I think we'll open it up now for questions.
Perfect. Thank you very much, Ms. McLaughlin. Right now, we're going to unmute all callers for the question and answer section. Please be aware of any background noise at this time and self-mute as needed. If you are going to ask a question, if we wouldn't mind introducing yourself and then asking a question, we definitely appreciate it. So we're going to unmute all the callers at this point. So one of the questions that came in via text is, if you weren't or you're just about to turn 65, how does the enrollment period work in that circumstance?
Just about to turn 65?
That's correct.
Okay. If you're not already getting Social Security, then you would need to go through the Social Security Administration. You can do it even online to apply for Medicare.
Okay. Are there any other questions from the audience at this point? Sounds like we have some external conversations going on, so that's good. Hopefully people are aware. If you wouldn't mind, Jennifer, can you also just take a moment to cover again that you are going to be going out to do multiple presentations throughout the community, and also the best way to contact the Lake County Council on Aging if people have any questions.
Our Medicare 101 presentations that will be starting in October, running through November at the various senior centers as well as the public libraries. So you'll want to be in touch with the center that you go to most or the library. If you have any questions or if you would like some one-on-one counseling for Medicare, you can contact the Council on Aging at 440-205-8111. We set up one-on-one appointments to go through your Medicare options during open enrollment, but also during the year if you're new to Medicare.
Perfect. If there's not any other questions for Ms. McLaughlin at this time, we want to thank you all for participating in this free online presentation. If you have any further questions, you can contact Ms. McLaughlin at the Lake County Council on Aging by calling 440-205-8111. Again, that's 440-205-8111. This concludes today's presentation. We hope you have a wonderful day. Thank you again for participating.